85. Channel 85.
Hey, Sam.
Little S, big A, little M. What up, Brandonovich?
So how's your heart, Sam?
I mean, it's fine. It's there. It's beating. It's a little broken on occasion, but we're not going to get into that.
Lance K. Gould,
And we're off.
yeah, is a physician based out of Texas who has found a way to not just treat, but reverse heart disease.
Well, that's awesome.
Yeah.
Cool. How did he do that?
Well,
Or what?
years and years of practice and research, I think, is how he did it.
Well, you're just so funny. That's cool, though.
So heart disease is actually the biggest killer in the United States.
I mean, I feel like I hear that on Cheerios commercials and stuff.
I think it's about 800,000 people a year die in the United States from heart disease.
That's not good.
If we think of another big killer, AIDS, we think how devastating it is.
Yeah.
I think it kills 30,000 people a year.
Wow.
So heart disease kills more than 10 times, would that be 20 times the number of people that AIDS kills? So heart disease really needs a lot of attention.
Yeah.
And that K. Lance Gould has found a way to reverse it.
Yeah,
Is
why?
actually a great benefit. So some of his early insight into it comes from actually World War II, when soldiers were killed on the battlefield, and when they would do autopsies of these soldiers who would be in their late teens or early 20s. Up until that point, everyone thought heart attacks just happened when you got old.
Yeah.
And it was just something that kind of came on suddenly at that point. What they found with these soldiers that died in World War II is that they would see early signs of heart disease in men who were in their late teens and early 20s.
Huh, interesting.
So at that point, whatever was causing the heart disease was already in play. And if you add decades of time on that and accumulation.
Yeah.
So, and part of that is you have cholesterol building up in the arteries, the hardening of the arteries. So what Dr. Gould has looked at, is found, is a treatment that combines exercise, diet, surgery, and medications.
All very doctory things to come up with.
All very doctory things. And the ratios, like who needs what, more of what, and how much of what, does depend on each person.
Well, it makes sense.
So they do need to consult their doctor to see.
As with everything, really.
But when it comes to the diet and exercise play a far greater role than was previously thought in not just preventing, but actually reversing heart disease.
Wow. So we should all get out there and exercise more?
Well, we should actually, we definitely should get aerobic exercise. And these, the diet recommendations for reversing heart disease, and not everyone needs to go out and do this, like they really should talk to their doctor, is an extremely low-fat diet. Low-fat, high-fiber, a lot of plant-based foods. A lot of
What
nature.
up? Nature.
Yeah?
Yeah.
So Dr. Gould uses the PET scan to look at blood flow and can actually map blood flow in the heart.
Weird.
And a lot of heart attacks happen because there are arteries that actually supply the heart with blood. Even though the heart is supplying the rest of the body with blood and pumping it, it needs its own blood.
Yeah, of course.
And if one of those arteries blocks, that's usually what causes a heart attack.
Oh, I did not know that.
Now, different people have different causes of their heart attacks. And this is why people need to talk to their doctors, because it's pretty individualized who has what cause.
Interesting. Very interesting.
But even people who aren't at risk for heart disease or who aren't currently experiencing heart disease can increase their exercise and lower the fat in their diet to gain the benefits, at least some of the benefits, to try to prevent and hopefully reverse heart disease.
That is way cool.
Yeah. So
That's
anyone
how
who
I
wants
feel
to
about it.
try this, I think we need to put it out there so that people can investigate it and read what Dr. Gould has written.
Absolutely.
They need to consult their doctor, though, before they make any changes in their own lifestyle.
Sha.
Yes.
Yeah. So, if you have any questions, comments, or concerns about heart disease, reversing heart disease, dieting and exercising and all that jazz that we just talked about, you should totally hit us up at scientificstation.com.